So, I give an example. At the University of Padova, one of Galileo's contemporaries said, "I do not wish to approve of claims about which I do not have any knowledge, and about things which I have not seen, and then to observe through those glasses, i.e. a telescope. It gives me a headache. Enough. I do not want to hear any more about this." So he refused to look through the telescope, didn't have any interest. And so the analogy we want to draw is that today there are new tools that extend the limits of human perception, but the epistemic authorities to some degree is the political scientific establishment itself that's resistant in many cases. Not universally, but there are certainly some people who refuse to participate in using these new tools and just sort of say, no, we don't need to participate in this to know about it. And of course, we're not the first to make the claims that psychedelics are as to the mind as telescopes or microscopes are to the cosmos or to the micrological or microscopic world. So with this question comes the issue of self-experimentation. To what degree does one have to participate in the use of the tool in order to fully achieve its cognitive benefits, or at least to participate in a kind of intersubjectivity by which one can take part in conversations about what's being realized through it? So there's an early history of self-experimentation going very far back into science. Of course, the very first beginnings of chemistry were actually in alchemy, when alchemists were doing all kinds of experiments and often involving themselves, including the discovery of alcohol, for example. The distillation of alcohol was one of the first examples of an extraction of a psychoactive substance. Humphrey Davy, one of the early British scientists, learned to extract nitrous oxide and did self-experimentation on himself. Of course, we still use nitrous oxide or laughing gas in modern medicine today. Medical applications weren't discovered right away, but there were lots of rambunctious experimentations going on, sort of as much for recreational purposes as for scientific, but it was partly a scientific enterprise. More famously and more recently, in the end of the 19th century, Arthur Hefter was doing experiments on mescaline, and William James, of course, an early psychologist, was doing further experiments on nitrous oxide. But at the end of the 19th century, there was another intellectual trend going on that sort of pushed away that idea of self-experimentation. That was towards objectivity as an epistemic virtue. So new techniques and tools were being developed to remove the scientist or the observer from the participation of observation. So self-experimentation began to be regarded as suspect or even delusional and not acceptable professional practice. However, of course, and that obtained for most of the 20th century, and still today, I think, for many people, it's a sort of fundamental philosophical question, is what is one's objectivity reduced or diminished by having direct experience with the object of one's investigations? I know I have my intuitions on this, but I want to leave it an open question, and certainly it's one that scientists need to think deeply about. But in the world of psychedelic science, the paradigm has been challenged. So both to establish empathy with research subjects and to validate the interpretation of data. Whoops. So we saw early psychedelic research emphasizing the importance of psychedelic experience. Today we see groups like MAPS doing training for psychotherapists who are using MDMA, first having to take MDMA themselves to better understand the experience that their subjects will be going through. And of course, in the ayahuasca world, Benny Shannon has said one cannot do ayahuasca research without having drunk ayahuasca. You can do as much laboratory work as you want, but if you have not drunk ayahuasca, what can you really say to know about the topic under investigation? Of course, we also want to point out that experience itself does not necessarily warrant findings. So just finally, about the politics of knowledge, what we've seen is a constraining of academic inquiry because of the politicization of science. The research imagination itself is constrained, and there's certain kinds of questions that aren't even conceived of. But then through the process of applying for grants, receiving grants, submitting to journals for publication, getting articles published. In each case, there's a kind of conservative winnowing process whereby the authorized knowledge about drugs that's used for example, legal cases or political policy decision-making is a very tiny sliver of what is potentially possible in investigation. So in the world of ayahuasca, some examples of these political hurdles are still very current with us today. Gabor Mate, a Canadian physician, was shut down by Health Canada for doing his research in a First Nations community on ayahuasca and addictions treatment. He was basically given a cease and desist order. He continues his work, but just not in Canada. Jeremy Narby, there was a case, he was invited to speak at the University of Liège in Belgium, and then was subsequently, he gave a half-an-hour talk on ethnobotany, mentioned for he said about 2 minutes, mentioned ayahuasca, and then was served with a charge of criminal incitement to use illegal drugs, and he's still fighting it today. As far as I know, it hasn't been dropped. He's had to hire a lawyer, and this is in an academic setting where he was invited by the university to go and give this talk. But there was a member of the Belgian anti-sect or anti-cult task force in the audience who charged him with this crime, so-called crime. And then Bia Labate, of course, has had a similar experience at the University of Sao Paulo in speaking about ayahuasca and then being investigated or Bia can tell you more about her experience, but it's another example where the academic freedom to make these kinds of inquiries is being challenged by the conservative political establishment. In terms of funding, again, it's very difficult, at least so far, to be getting research funding. It's happening in some places, but there's lots of granting agencies that are very conservative. So that's led Dr. Brian Rush and the Ayahuasca Treatment Outcomes Project to crowdsource. So last year they did an Indiegogo campaign and received over $30,000 of seed funding to develop a research project. And this was, of course, from the community making small donations. So in conclusion, the therapeutic options and human rights protections in the current governmental context require scientific evidence, but science itself has some deep sort of philosophical explorations to do with respect to the object of study and the methodological ways that it goes about studying the topic that we would just kind of want to present for consideration in this forum. So I'm going to leave it there. Thank you very much.
Okay, thank you, Kenneth. I forgot to tell you that Kenneth Tupper is adjunct professor at the University of British Columbia in Canada, and Beatriz Labate is also co-author of this presentation. We have 5 minutes after each presentation. If you have any question, Kenneth can answer you.
Yeah, I just want to share an experience because some people here are maybe interested in Ayahuasca. And I tried Ayahuasca specifically to compare to ayahuasca. I tried it with a synthetic MOA inhibitor, so basically the most reductionist equivalent to ayahuasca possibly. And what I expected was happening is not the same. It kind of opens up all the channels, but there is no transmission, there's no communication. So it was exactly what I expected. Ayahuasca lacks the intelligence, the content, the message that ayahuasca has. And when you mentioned like how to reconcile ayahuasca with the naturalistic reductionism of science, well, I think the first thing that ayahuasca shows you that this reductionism is wrong. So I wonder if this reconciliation is even possible. And also this reductionism is obviously the cause of many problems that ayahuasca maybe helps us to overcome. So I'm a bit doubtful about trying to grasp ayahuasca with this scientific mindset because it's not the right one. And I wonder what your perspective on this is.
I think those are fantastic questions that get to the heart of exactly what we're trying to explore. I don't want to make any kind of determinations. I think the challenges are, you've just articulated them. I don't want to say we shouldn't do science. I think science is an extremely valuable way of knowing. What we're trying to say is it's not the only way of knowing, that there's other ways of knowing that are equally or perhaps even more important to grasp what it means to be human, what it means to live in the world that we live in. So science, I think the original meaning of the word science was knowledge, right? It comes from Latin, but it's been redefined over the past several hundred years to mean a very particular form of inquiry and very reductionist, materialistic, things that can be quantified and measured. But we'd like to suggest that the word science needs to be broadened, or perhaps we just need to reconceive of what kind of valuable knowledge is, especially in the world of legal and policy making, where these very important human rights considerations are being determined based on very limited evidence base. So I think Alex and then Glenn.
Yeah, that's a good question. In terms of this distinction between synthetic and organic ayahuasca, it makes me think of the work of anthropologist Daniel Goleman, who showed that from his work on placebo, that red sleeping pills work better than, blue sleeping pills work better than red ones in the association. And also that Panadol, brand paracetamol, works better in countries where the advertising budget is bigger. emotional associations with the objects of the drug, creative experience. I'm wondering in what ways that approaching ayahuasca as a cognitive tool, in what ways may this have effects upon the actual experience of ayahuasca. Compared to say ayahuasca as a plant teacher and an interpersonal relationship with the plant spirit. I understand that the cognitive tools discourse is about coming up against policies and governments and all this stuff. But what about the effects and the potential reductionism it has on how people relate to phenomenology of the truth?
It's an excellent question. We struggled with this exactly. You're trying to build the bridge from the traditional indigenous knowledge conceptions into the modern conservative academic world, and thinking that the plant teacher concept is going too far for many to be comfortable with. And I think Bea and I would say we don't want to be disrespectful to the traditions, but to build that bridge, to start firmly rooted in it, and to assert, the plant teacher concept is somehow ontologically valid and real, would turn off, I think, many scientists to the point of just like, no, I'm not going to even bother to inquire. This is, it's kind of animism we know from long ago has been rejected. I'd rather propose that they consider the cognitive tool approach, and then maybe with some experience, that's, I think, been my experience, is there's a lot of weight that I get from the plant teacher concepts, from the sort of animistic spiritual element to it, from the experience itself. So I think, you hit the nail on the head with a really challenging question. Bea wants to say something.
I just want to say something, Julian. I would like to talk about, I think we don't have time, that when you say, I tried ayahuasca and I found out exactly what I experienced. It doesn't have intelligence. I don't think that it's a scientific question, because you can just say you're suggesting yourself, if you already know what you want to find out. Like, it seems more like you're trying to confirm the theory that this doesn't have spirit. It doesn't seem scientific to me as a question to say, I'm going to try and I found out exactly what I already knew, because we can suggest ourselves. If you go to an experience saying, well, this is going to be empty because this has no soul, because this is a synthetic. So I was having this idea to give a synthetic thing to a shaman, which caused some controversy with my colleague Glenn yesterday, which was this idea that you would give it to a shaman and ask him to examine it, like comparing it. Not that a shaman is better, but okay, let's suppose this guy knows about plants. So give it with a scientific attitude to test. Let's give this guy the plant and the synthetic thing and tell him how does he see that under the grid comparing to a plant. And then the discussion with Glenn is saying that, so we're saying this is reductionism, because we take the alkaloid, we say there's a spirit plant, and for the chemist, oh, okay, nice, but let's get the alkaloid, and this is the substance, and this is it. And what Glenn is saying is like, when the indigenous people say, I drink the plant, therefore I drink the spirit, I drink the soul, there is no distinction mind and body. So for them, in their logic, he's saying it's the same. And I was having this huge discussion with him yesterday, because I was saying it's not the same. Because for the chemist is saying, the only thing that matters is the alkaloid. And the indigenous person is saying any part of the whole represents the whole. The alkaloid represents the spirit and the soul, but also the non-alkaloid represents the spirit and the soul.
Well, it's interesting that Albert Hoffman, when he synthesized psilocybin, brought it to Maria Sabina and gave her psilocybin capsules, and she said, oh, here it is, I don't need mushrooms, or at least mushrooms when they're not in season. I have another tool that works. She said the spirit of the mushroom was in the capsule. So it's an empirical question. These are the kinds of questions that we should be investigating scientifically, is let's open up the discussion to explore these kinds of things. So I think we probably got to shut it down, but take one more from Glenn.
I think the missing piece that sort of addresses all these things is ritual. Because, this idea of cognitive tools is fine, but they're used in a ritual setting. And a ritual without any kind of psychoactive substance produces all kinds of consciousness. And ritual has been studied a lot by anthropologists, by psychologists. And so if you look at psychoactives as cognitive tools used in a ritual context as ritual enhancers rather than, I think the idea of a telescope and a microscope is a little bit pushing, because people they don't use ayahuasca like they use a grinder. It's a different kind of tool. It's used in a ritual space. And I think if you could bring in ritual studies to see the placebo effect. What is the placebo effect? The placebo effect is ritual. It's the impact of the ritual of taking a medicine, whether it's a red pill or a blue pill. It's all ritual. So I think if you incorporate the idea of ritual into this, how you study these plants, you fill in that missing gap, because ritual creates all these other kinds of cognitive and spiritual and physiological effects that help fill in that spirit gap.
Yeah, no, I agree completely. I want to go back to Vygotsky's concept of cognitive tool, and he uses literacy as an example. And of course, literacy got codified into religious practice through it was a new technological invention. We've spoken languages for tens and tens, or if not hundreds of thousands of years, but written language has only been around for about 5,000 years. But one of the first things that happened to it is it got codified into a particular kind of ritual practice, especially, Judaism originally with the Torah, and then Christianity with the Bible, and then Islam with the Quran, where they've kind of taken the text and fetishized it in a way. And of course, all kinds of rituals sprang out of it. But it's still, I would like to say that cognitive tool element of literacy still exists. And I think the same is true with cognitive tool elements of psychoactive substances. I agree completely, the ritual's really critical. The laboratory itself is a kind of ritual, just a very different kind of ritual.
They create special rituals.
Yeah, exactly. Okay, so thank you very much.